Attacks on social workers are a really serious issue. We've recently had a report from the British Association of Social Workers, their Northern Ireland division, and they did a survey of social workers here, and I have to say I was quite shocked by the findings. They found that 86% of social workers working in Northern Ireland, or amongst those who responded, had experienced intimidation, 75% had experienced some form of threat, and 50% had actually been subject to physical violence. These problems take lots of different forms, ranging from words said in anger through to really serious threats and intimidation that leave people genuinely concerned for the safety and well-being of themselves and their families. A worrying trend is the increasing use of social media, where we're seeing people using social media to identify social workers, make allegations against them. This is a really serious development. Well, I think it's important to recognise that every day health and social care trusts are supporting people and responding to these threats and this intimidation and the attacks, supporting employees, but more can be done. So what we're doing is we've set up a task force, and the idea is that this task force will gather together examples of best practice, what social workers have told us really works for them in terms of trying to prevent attacks, in trying to minimise the impact of threats and violence, and in terms of supporting people after something has happened. The task force met for the first time last week. It was a really positive meeting. Everyone was making a strong commitment to work together and to work collaboratively to produce this guidance. And we've set a timetable. We hope that we'll have a product ready for use by the system by spring of next year.